Let me just start by saying that any group that dares to dream of a cancer-free America deserves so much respect. And any group that dares to dream of a cancer-free America has undoubtedly these four elements: courage and commitment, compassion, and caring. And to me, that's what characterizes this extraordinary group of leaders at this extraordinary time. First, with respect to courage and commitment, when we look at the cancer situation in this country, it's easy to be overwhelmed by the challenges of incidence and mortality, the challenges of covering people and getting people the treatment and prevention they need and deserve. But you have looked beyond the barriers and you've created and upheld this vision that is inspiring all of us today, and I want to thank you for that. One person who shares this vision with all of you is the President himself. And in fact, in his very first address to Congress, he called for, quote, a new effort to conquer a disease that has touched the life of nearly every American by seeking a cure for cancer in our lifetime, unquote. So I know the President joins all of you with respect to that courage and commitment. But critically, even though we've heard some very compelling statistics today, this courage and commitment is based on human voices and human stories, and that's where the compassion comes in. And I don't think I've ever heard someone speak as powerfully and as compassionately as Tamika. I often like to point out that the word passion means to suffer, and the word compassion means to suffer with. And Tamika, your story is very moving and very inspiring. I hope all of you saw Tamika's story also in the Washington Post just a couple days ago. That was a wonderful lead to this launch today. The physician and poet William Carlos Williams has said that we owe it to each other to respect our stories and learn from them. So there are, unfortunately, many other stories that we can tap into with respect to this launch. One story I want to tell you about is my own. And I am a physician who has cared for patients for over 30 years. The desire to cure cancer was a big motivator for me to go to medical school and become a young doctor. But very early in my training, I saw too many cancer patients dying preventable deaths and suffering preventable suffering. And very quickly, I started thinking about cancer prevention. This is some 30 years ago, when public health is not nearly as developed as it is now. And there were moments where I would turn to colleagues and say, gee, can't we talk more and have more focus on cancer prevention? And the response I'd often receive is, cancer prevention, that's not a term. That's an oxymoron. That's two words that don't belong next to each other. So I started collecting my favorite oxymorons like guest host and jumbo shrimp and male ladybug. But the word prevention became a passion for me. And in hindsight, that was the beginning of my public health education, even though I didn't realize it. And I'm very, now in hindsight, grateful for that passion that came out of this anguish, because it's led me to this wonderful launch today. My own journey has now led to 10 years as a former state health official, so it's great to see Dr. Engel and Dr. Devlin here and other members of ASTHO. Through academia, got to care for patients for over 30 years, which was a privilege and if not a sacred experience. And now to stand here before you as the Assistant Secretary for Health. And on days like this, I can say to this group, cancer prevention is no longer an oxymoron. It is a vibrant public health reality, and I want to thank you for that. And then with respect to furthering compassion on behalf of people who are affected, we have heroes like Tamika who could have turned inward with their pain, but they have turned outward. They've channeled their anguish into action, and that's what all of you have done. You have seen the suffering, but you've decided to do something about it. And then ultimately, we are a caring community living at a transformative time. And I do stand before you as a member of this incredible administration some 14 months after the Affordable Care Act was signed into law by the President. You're hearing so much about health reform these days and so many aspects of it, but I would summarize the Affordable Care Act and health reform in a single concept. It gives patients what they want. And all of us are patients, and all of us as patients want three things. We want good care, we want good insurance so we can get good care, and we don't want to be patients in the first place. We want better prevention in public health. And if you look into the Affordable Care Act, the law of the land, and how it applies to a cancer-free, cervical cancer-free America, there are several lessons that we can share. First of all, you have heard that this is a condition that often strikes young people. You also have heard that prevention is essential for people very young. So the Affordable Care Act now extends coverage through new plans so that young adults can stay on their parents' insurance up to age 26. So that is a huge advance with respect to coverage. Then also many people have pre-existing conditions and they have been denied insurance for some 6 months or more. They can sign up for insurance right now on the website through www.pcip, pre-existing condition insurance plan.gov. So that is a way of giving people access to the insurance they need and deserve right away through efforts like this pre-existing condition insurance plan. We also have a new patient's bill of rights through health reform so that there are, for example, no more lifetime coverage limits on people. So, for example, if you are a cancer patient, you're getting treatment and your costs are rising and you're starting to worry that your insurance will stop and not cover you anymore, you don't have to worry about that anymore because of health reform and the new patient's bill of rights. There are no more lifetime dollar limits on your coverage, and by 2014 there will be no longer annual limits on your coverage as well. And then the part about the Affordable Care Act and health reform, which I think is most thrilling to all of us, is it really makes prevention come alive. It really makes public health come alive. Now, there are some people who have the temerity to say that prevention is dull and prevention is, God forbid, boring. I completely disagree. I think this is the most exciting field in public health. There's a wonderful saying from Dr. June Osborne, the former dean of Michigan Public Health School. She said, when prevention works, absolutely nothing happens and things are very boring, ... Let us all pray for a little boredom. And what she meant by that was that our good health is a gift, and every day is a gift. And when you have the gift of a perfectly healthy, normal day, that is precious, and it has to be protected through the strongest public health possible. So these preventive measures are now strengthened through the Affordable Care Act, and you've heard from some of my predecessors on this podium that there are new prevention benefits through health reform. New plans have to cover prevention, high-value prevention interventions such as cancer screening, like pap smear, like mammography, like colonoscopy, and other interventions as well. And so there's so many ways that this new law gives people what they want: better care, better insurance, so they can get good care, and so they don't have to be patients in the first place. So as I end, I want to thank you for daring to dream. You have offered this vision that is inspiring an entire country. You have made prevention come alive. You have given us hope for a better system of care and treatment in the future. And I can say that we at the Department of Health and Human Services will be with you every step of the way. Thank you very, very much.